वो जो ऑनलाइन है वो दिखेगा मुझे, उसको भी करना देख रही गिरी 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 बॉटल गिरी, बस 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 चलो. Hello friends, so now today we'll discuss up the test and discussions of microbiology for the INI-CET exam. And as you know that the infectious diseases every time they form up a chunk of the questions, like 30 to 40 in fact in every exam. Sometimes it comes in direct form, sometimes the integrated form, and you know microbiology integrates well with all the clinical subjects very, like with the medicine, surgery, ENT, in fact ophtha, along with that PSM. So we have all sorts of integration in all these subjects. So this itself is telling up that if you have a sound knowledge regarding the microbiology, you could able to solve around 30 to 40 questions easily in any sort of exam. Okay, and for that you will definitely agree also on this particular aspect. Okay, so let's start up without wasting time with the first question. And as the first question is a 47-year-old man suspected to have community acquired pneumonia was treated with antibiotics. When he failed to improve with the antibiotics, obviously certain test was being done and this rare diagnosis of histoplasmosis was made. Among the tests ordered was serology for this particular one, direct examination and the culture of the induced sputum. In the culture, the microscopic morphology most useful in identification of the etiological agent which does this histoplasmosis is, and your options are arthroconidia, microconidia, sclerotic bodies and tuberculate macroconidia. Okay, the voice is coming or not? Yes please, Shilpa, the voice is there or not? Can you tell me please? Those who are online, please tell me the voice and all is fine. Ashish, now the voice is coming? Voice is coming? Okay. So, what should be the answer in this particular one? As Shilpa said C, Sahil said D. Yes, anybody else wants to try this? What should be the answer in this particular question? Acha, okay Sahil, fine. So, the answer is, as the Sahil have told, D. Okay, the answer here is what? D, that is the tuberculate macroconidia. That is what? Tuberculate macroconidia. And how we have reached to this answer? First of all, you should know some things like chronic histoplasmosis mimics up tuberculosis. Okay, this particular one, because in the TB the cavities are there, and chronic histoplasmosis also the cavities are there. So one thing is that. Okay, besides this, what else needs to be remember here is that histoplasmosis is being done by histoplasma capsulatum. Okay, this particular fungus, and interestingly the name suggests it to have a capsule, but it doesn't have a capsule. Okay, capsulatum does not have a capsule, one thing. Besides this, it's a dimorphic fungus, and this particular dimorphic fungus exists in two forms. You already know that one is yeast form and one is mold form. The yeast form of this is narrow based budding. Okay, the yeast form of this is what? The narrow based budding yeast cells, and the mold form is this which we are talking about, that is the tuberculate macroconidia. Okay, that is the tuberculate macroconidia. I should write this side. Okay, tuberculate macroconidia. Is it fine? So this particular one is a dimorphic fungus. This should be known firstly. Other than that, It is having yeast form as well as mold form. And can you tell me which all dimorphic fungus you know? What should be the mnemonic for that? What is the mnemonic for that particular one? That which all are dimorphic fungus? So, if you remember that the mnemonic HSBC, please try the bank, which is of paramount importance, HSBC, you should try that particular one. And what is that HSBC? Histoplasmosis, sporotrichosis, blastomycosis, the disease name I am telling up, coccidioidomycosis, paracoccidioidomycosis and telaromycosis. And telaromycosis is an important entity which is being asked again and again by the AIMS fellows, common in HIV positive and give a brick red color pigment with brush border conidial arrangement. Coming back to the question. So basically what they wants to know here is these all dimorphic fungus. You know that they involve the lungs first, fine, and then they go to the viscerals, and after that going into the viscerals they involve the visceral involvement and thereby becomes what? Systemic mycosis. So all the dimorphic fungus, what they do? They does systemic mycosis or deep mycosis, and one of them is this, and others names I have already told you. And in that, this is there, which is to be remembered, tuberculate macroconidia. And how does it looks like, tuberculate macroconidia? It looks like a sunflower, okay, it looks like a sunflower. So remember this particular aspect very clearly, okay. So answer to the first question is what? D. Now coming to the second one. A 25-year-old female had surgery for a crush injury to the chest, fine. She had central venous catheter being put, was intubated, was on a mechanical ventilator. 3 days post surgery she developed a fever and was treated empirically for the bacterial infection. But the fever persisted. Still the fever is persisting. Fungemia was suspected and the blood culture for the fungus was observed. Okay, means it is being ordered by the ICU fellow. The empirical antifungal therapy was initiated and the central venous catheter line was removed. The removal of the catheter is indicated because, okay. So can you tell me why we need to remove this catheter line? Yes, what should be the answer? In the comment section you can give up that what should be the answer in this particular one. Yes please, what should be the answer in this particular one? As per you, those who are online, please tell. Tell. I am waiting. Tell please. C. Okay. So one of the answer is C. Sahil told. What else? What else? Anybody else wants to try for this? Soumya told A. Okay. That there is a growth of the Aspergillus fumigatus biofilm. Okay. Yes, anybody else? Hamid told D. That is, might be Aspergillus fumigatus planktonic growth. Okay. Answer here guys is this particular one. Fine. This is the fungus Candida albicans which does produce biofilm also. Okay. So Candida albicans is the one which produce the biofilm and thereby it attaches to the various particular ones, surfaces and all. So answer should be what? Answer should be B in this particular one rather than the cryptococcus and all. Candida can also involve a number of other sites and already you know that it can do what? Candidemia, and that candidemia is what? Invasive candidiasis. Okay, that is the invasive candidiasis. So remember this particular aspect here, because of the suspected presence of Candida albicans biofilm, you need to remove this central venous catheter. Okay, so these types of questions definitely can come up and you need to treat up these particular ones according to this, because it is being attached to this one central venous catheter. That's why you need to remove it, the foci of the infection that you have to remove up, then the patient will improve very fast. So that's what the logic is, that's why you have to remove it. So answer is B in this particular one. And the other like what I say, probable question which I think can come in the exam is Candida krusei. Okay, Candida krusei. This particular species of Candida, Candida krusei, is found to be intrinsically resistant to the azoles. Okay, this particular one is found to be intrinsically resistant to what? The azoles, because we know the drug of choice for Candida is what? क्या है Candida की drug of choice? Fluconazole. Okay, but this particular krusei is found to be intrinsically resistant to the azoles. It was asked in the previous INI-CET exam. Again, it can come. It is intrinsically resistant. So that's why what you need to use, LAMP. And what is LAMP? Liposomal amphotericin B. What do you need to use? Liposomal amphotericin B. Is it fine, guys? So remember this particular one aspect also regarding the Candida. And the recent one which have come in one of the exams of the NB board is a lady is there having in the discharge hyphae, pseudo hyphae and certain E cells. Means all the form at one go can also be observed in Candida albicans. So remember this particular aspect also, that if in the question it is being written up regarding the true hyphae, okay, or constrictions like pseudo hyphae or E cells or budding E cells, any sort of these things are being given in the exam, they are talking about what? They are talking about the Candida albicans. Fine. Besides that, those two phenomena, one is Reynolds-Broad phenomena and the chlamydospore formation on corn meal agar. Okay. So one is Reynolds-Broad phenomena. You know this name, Reynolds-Broad phenomena. Okay. And the other one is the chlamydospore formation. Another one is what? The chlamydospore formation. And these chlamydospores are asexual spores and they are being formed up on where? On the corn meal agar. So these are the important ones which you need to remember in this particular one. Candida glabrata also resistant. Not intrinsically resistant, Sahil. Okay, it is found to be resistant in number of cases, but it is not intrinsically resistant. Intrinsically resistant, you have to remember this name, that is krusei. Otherwise, number of non-Candida albicans, they are found to be resistant to the azoles. But जो अंदर से ही गड़बड़ है, वो अंदर से गड़बड़ कौन है? Candida krusei. Okay, so remember this particular one also. Now, here only I like to tell up that how they can give the same question in the other format also. Okay. The same question can be given in other format. How, guys? They can give in this particular aspect that which particular test, okay, which particular test you will like to do in this particular one. So remember, you will like to do this particular testing, beta 1,3 glucan testing. Okay, beta 1,3 glucan testing. And this beta 1,3 glucan testing, as I have already given you the mnemonic for the same. And what is the mnemonic for the same? CAP. And what comes in the CAP? Invasive candidiasis, invasive aspergillosis and pneumocystis xerovasi infection. Okay, pneumocystis xerovasi infections, invasive aspergillosis, invasive candidiasis. These are the three important ones in which you need to do this particular testing, that is termed as 1,3 glucan or beta 1,3 glucan testing. Another favorite of the INI-CET fellows. Another favorite one of the INI-CET fellows. And where you are telling about the germ tube test and all. Na? So germ tube test and all, they are done for the normal Candida infections also. But this particular beta 1,3 is done for the invasive stuffs. Invasive stuffs of what sort? That in the blood the Candida is coming up. In the urine, the Candida is coming up. So that is the invasiveness. So that is what is termed as invasiveness. It is going into the lungs and causing a problem. So all those particular things is what? Invasiveness. So in them, you need to go for what? Beta 1,3 glucan testing. Another favorite one is regarding this. That is the chrome agar method. And the chrome agar method which is being used for the Candida speciation. Okay. So this particular name also you should know, that for the Candida speciation, which particular method is used? The answer is chrome agar method. And what is chrome agar? Chrome means color. Colorful agar is available in which you grow up the sample and when you grow up that particular sample in that, this particular, just after having a leaflet of it, you can tell up that whether the glabrata is growing up, cruzi is growing up, or anything else is growing up. Okay, so remember in that particular aspect all these particular things. Now coming to the third question. A 4-year-old child develops tinea corporis, that is the ringworm infection. The lesions clear using preparation for treatment of athlete's foot. Okay, treatment that will have taken up for the athlete's foot, and the lesion reappear on the child and the playmate in a few weeks. The other fellow, the child's friend, also developed the lesions. The internet research suggested to the mother, which is being done nowadays by everybody, Google up, that the family pet might be the source of the infection and should be taken to a veterinarian to know the cause. If this is the mode of transmission, the etiology is most likely to be. Yes, please. What should be the answer as per the person who are online? Please tell me. Is it Epidermophyton floccusum? Is it Horte wernicki? Is it Malassezia species? Or is it Microsporum canis? Please tell. What should be the answer? Yeah, tell please. What should be the answer in this particular one? The Sahil have told D. Anybody else wants to try for this? And the Sahil is correct in that the answer is Microsporum canis. Okay, because as they have told up regarding the pet and all, and as the name only is suggesting up, this is there in that particular pet which have lead to this ringworm infection in this particular one. Okay, so basically the athlete's foot and one more that is termed as dhobi itch or jock itch, okay, they are being done by two fellows. Which two fellows? One is Epidermophyton floccusum and one is Microsporum canis. Okay, along with that the Trichophyton rubrum. These three fellows names you should know, which involves up in causing up these particular infections of athlete's foot and even the jock itch and all. Okay, regarding the rubrum, the last INI-CET question was, does it produce a pigment? Yes, it produces a red color pigment, and remember how after rubbing the things have become red. Okay, so red color pigment is being produced by rubrum also, and this particular Microsporum canis, okay, which is obviously happening in the animals, can be transmitted to the humans, zoonotic infection types, and these types of infections definitely can happen, that is like athlete's foot and all. Okay, so remember here the answer is what? D. And as you know regarding the dermatophytes, a lot of other things like Trichophyton, it involves of what? Microsporum, it involves what? And there is Epidermophyton. So remember like this, tri means all the three: skin, hair and nails. Okay, skin, hair and nails. Microsporum, M, do not involve N. So what is remaining up? Skin and hair. Okay, skin is common to all. Then comes the Epidermophyton, skin, and then what comes? Then comes the nails. So first of all you should know this also, that which involves what? So Trichophyton, skin, hair and nails. Microsporum, M, do not involve N, so skin and hair. Epidermophyton, skin and nails. Another important thing as per microbiology which ought to come in the exam is that regarding these particular fellows, what should be the shape which you should think for the macroconidia and for the microconidia stuff. So firstly, if we talk about the macroconidia, the Trichophyton is cylindrical. Okay, this particular one is what? Cylindrical. Another name is pencil shape macroconidia. Okay, as far as the microconidia is concerned, they are numerous. They are numerous in this particular one. Other than this, in the microsporum, it is spindle shape. It is spindle shape. And in the Epidermophyton, this one is club shape, and even we can say boat shape. So this is the macroconidia stuff, whereas the microsporum, in this the microconidia are less, and the absent microconidia is a feature of epidermophyton. Okay, and how to remember them in the exam? Trichophyton it is. So trichophyton means, remember like this, tricycle. Okay, you know na tricycle. A child is playing with his or her tricycle, and in that tricycle that fellow have put what? Pencils, like the spokes. Okay, so now this is sorted and already asked question, pencil shaped macroconidia is a feature of. So that is trichophyton. Microconidia, numerous microconidia. Okay, and imagine like this, the pencils are numerous with that fellow. You have taken a full pack and put them in the spokes, as a spokes in the wheel. So trichophyton, this one, that is a cylindrical one. Then microsporum, SP, that is spindle, and micro itself means what? Less. So microconidias are less. As far as the epidermophyton is concerned, club or boat shape. Now in this, what you have to imagine up, that there is a club over which somebody have put a boat. So you have to imagine this, because now a lot of marketing strategies are being done by the various clubs also to attract the tourist and all. So what this particular club have done, it have put over it what? A boat, to show up to the fellows that uniqueness. Fine. And what about the microconidia? That is absent, means the small children, they are not allowed to go into this club. Remember like that. Okay. So these are the important points which definitely can help you to crack up these types of questions in your exam, and this is ought to come. Okay, these all things, they ought to come. And here if I like to add upon into this, so let me add upon the favus and the kirion, which are the favorite of the examiner again and again. Okay, without that they don't like settle up for the exam. Favus is the infection of the scalp, obviously, tinea capitis, and it what produces in this is cutla formation. This particular one is there, this particular thing is being formed up, and basically this is being done by trichophyton. It is being done by what? Trichophyton, Schonleni or Schonleni. Fine. And how to remember this particular one? Remember like this, favorite shoes लाने हैं. Okay, favorite shoes लाने हैं. So remember this particular name, Trichophyton Schonleni is the major cause of favus. And what about the kirion? The kirion is being done by Trichophyton verrucosum. Okay, it is being done by Trichophyton verrucosum, and it is being done by Trichophyton mentigrophytes. It is being done by verrucosum, and it is being done by what? Mentigrophytes. Okay. And this you already know, it was the previous question, and it's zoonotic infection. Okay, done by this verrucosum and mentigrophytes. And how we have learned this? We have learned this like this, that you have to imagine there is one fellow termed as Carey Minati. And Carey Minati, you know, always does what? Upset activities, mental activities. In that fellow have done what? He perforated his hairs. Okay, from where this perforation have come? This perforation have come from here, that there is a test which is being done. Already asked question of INI-CET, okay, which is positive in the case of mentigrophytes. I will tell you what it is. So remember like this, a Carey Minati doing mental activities, perforates his hairs and thinks he is doing some veerta wala work. Okay, veerta means braveness. And these types of fellows you should keep where? In the zoo. Okay. So you know na the upset activities of Carey Minati. So like that you have to relate up all the things and come to these particular answers. Is it fine? So verrucosum, mentigrophytes, hair perforation test positive, zoonotic infection. These all are important ones in the kirion. And frequently asked question is kirion, and both of them they comes in what? They comes in tinea capitis. They comes in what? Tinea capitis. Now coming to the next one. Tell me about this. A gram-negative bacilli releasing of the histamine to cause scombroid fish poisoning. So basically scombroid is a fish. All are responsible except, what should be your answer? Tell me. What should be the answer in this particular one? Klebsiella, E. coli, Vibrio vulnificus, Proteus. What should be the answer? Yeah, try for this. Yes, please. Klebsiella, E. coli, Vibrio vulnificus, Proteus. What should be the answer? The answer to this question is Vibrio vulnificus. Vibrio vulnificus is a halophilic Vibrio. Okay. This particular one is what? It's a halophilic Vibrio. Answer is C. Halophilic Vibrio. Okay. Important to note here is that scombroid fish poisoning, if somebody asks you that which is the most common cause of it, the answer goes in favor of Morganella. Okay. Then it is Proteus, and then it is E. coli, and it can be Klebsiella also. Okay. So remember this particular one, the gram-negative bacilli releasing histamine to cause scombroid fish poisoning is all except. Answer is Vibrio vulnificus is not in the list. Vibrio vulnificus does the another thing. It associates with coral cut wound infections. Okay, coral cut wound infections, and it is found to be 8% halophilic. It is found to be 8% halophilic. Otherwise, if somebody asks you regarding the scombroid fish poisoning, which name should come in your mind? Morganella. Morganella more than Proteus, more than E. coli, and even other Enterobacteriaceae members like Klebsiella can be there in this particular one. Okay. And what happens in scombroid fish poisoning, and what can you expect because of the histamine release? So this is an obvious question: vasodilatation and bronchoconstriction, and that is termed as type 1 hypersensitivity, and because of which the choking can happen and the person might die. Okay. So this is regarding this particular one. Now talking about this, a fungal teleomorph is, yes please, what should be the answer of this particular one? Ludwig's angina, Sahil? What is this? Ludwig's angina. It is cellulitis of the submandibular space. Ludwig's angina. Tell me about this fifth one. A fungal teleomorph is a asexual reproductive form, infective form for the humans, sexually reproductive form, or a dormant form. What should be the answer as per you? Can you tell? Yes, please. In this particular one, what should be the answer? Asexual, reproductive, infective form, sexually reproductive, or dormant form. Yes, please. Just a guess if you don't know. Just a guess if you want to tell. So answer to this particular one is teleomorph. Answer is sexually reproductive form. So this is the sexually reproductive form of the fungus, which you should know. Okay. And if you remember of that particular one, that based on spores, that is sexual spores, how to classify this? Okay. So that is JUB, that is Zygomycetes, Ascomycetes, and Basidiomycetes. Okay. So they all are what? They all are teleomorphs. They all are what? Teleomorphs, and they are the sexually reproductive form of these particular ones, and even they produce what? Sexual spores. So Zygomycetes is having which particular fellows? Rhizopus and Mucor. Okay, Rhizopus and Mucor. Asco is having Aspergillus, and Basidio is having Cryptococcus. And which family is having the asexual one? That is, in fact, that doesn't have any sexual phase, like the sexual phase. That is the Deuteromycetes. That is the Deuteromycetes. So all these which are there in this particular one, they all comes under which particular thing? Teleomorph, a new thing for you. Fine. Now coming to the sixth question. A 30-year-old female stores up her contact lenses in the tap water. She notices deterioration of the vision and visits an ophthalmologist, who diagnoses her with severe retinitis. The culture of the water as well as vitreous fluid would most likely reveal which of the following? Yes, please. Sixth. What should be the answer? Which of the following? Please tell. Yeah, yes, please. What should be the answer in this particular one? Anybody? Answer to this particular question is? Tell. Anurag have told perfectly right. Answer is A. That is acanthamoeba. Okay. So acanthamoeba, everybody knows, associates with contact lens keratitis. But not everybody knows the species name. This might come. Okay. Acanthamoeba culbertsoni. This is there which associates with contact lens keratitis. Okay, this is the one which associates with what? Contact lens keratitis. Which one? The acanthamoeba culbertsoni. And the same fellow can also associate with granulomatous encephalitis. The same thing can associate with granulomatous encephalitis. And you know, acanthamoeba is what? Acanthamoeba is free living amoeba. It is what? It is a free living amoeba. Okay. They do not need any sort of a host and they can manage their stuffs themselves. Okay. So there is one fellow Naegleria fowleri and one fellow acanthamoeba and one Balamuthia and one less known is Sapnia. Okay. Sapnia. These all are free living amoebas and they all are capable of doing what? They all are capable of doing the encephalitis. In fact, the Naegleria fowleri does what? It's termed as brain eating amoeba and this particular one leads to an entity termed as PAM. Okay, this particular one leads to an entity that is termed as PAM. Okay. So this is what is termed as PAM. Now coming to the next one, the seventh one. A working mother takes her 4-year-old child to a daycare center. She has noticed the child frequent stools are non-bloody with mucus and they are very foul smelling. The child has no fever but does complain of tummy hurting. Increase of the fat in the stool directs the pediatrician concerned towards a diagnosis of malabsorption syndrome associated with which of the following stuff. So this is a simple one which I think everybody should answer up. What should be the answer of this particular one, guys? Question number 7th in this particular one. What should be the answer? Please tell. It's a simple one. Please tell. Yeah. So no doubt in that the answer is what? Regarding the GRDSs. And this particular GRDSs often manifest as what? Malabsorption syndrome in the case of children. And this was a NEET PG question in which they have just mentioned up the bulky stools, okay, with foul smell. So this particular point you should know regarding the GRDSs. Another important aspect Okay. Now I will do, Puneet. Don't worry. Fine. That's why I have made like this now. So I will put it upwards, then you can able to see that. Fine. So this particular giardiasis is having the bulky stools with foul smell, and there is bulky stool formation because of what? Steatorrhea, that is the fat in the stools. Okay, it is due to this particular one, which is termed as fat in the stools. Okay. Now, the question which can come is that which particular ailment is there with which it can associate up. So that is selective IgA deficiency, okay, or CVID. And what is CVID? Common variable immunodeficiency. Common variable immunodeficiency. So these two names you should know, the selective IgA and common variable immunodeficiency, which associates with what? Recurrent giardiasis. Okay, they associate with what? Recurrent giardiasis. And the extra point which I think can come in your exam is regarding the traveler's diarrhea. Okay, remember Giardia lamblia also associates with traveler's diarrhea, mostly in the hikers and the campers, those who go for camping and all. In them, this can also do what? Traveler's diarrhea. Which one? Giardia lamblia. Is it fine, guys? So the answer to this question is what? Answer to this question is giardiasis. Now coming to this particular one, which we have already discussed up just now, you should tell a young girl having a pet dog present with deep boggy red areas characterized by severe acute inflammatory infiltrate, even the pustules are formed up. Probable infection kya hai ye? Okay, so basically again a repeat one, and you should tell what should be the answer, guys, in the comment section. Yes, please. Tell. What should be the answer of this particular one? 8th one. And Anurag, again you are right. The answer is Kirion. Okay, the answer is Kirion. And without seeing upwards, can you tell me up what should be the organisms which are doing this particular Kirion, and how does it presence of? Lakshman have told perfectly. It looks like a boggy lesion. Okay, boggy lesion, and this particular one is painful. This is a painful boggy swelling over the scalp. Important, associates with these particular pets like dogs and all. Okay, and this particular Kirion is being done by, yes, please tell me what should be the causative organism in this particular one. What should be the causative organism? Yes, please. Just now I told na, Trichophyton verrucosum. Okay, Trichophyton verrucosum and Trichophyton mentigrophytes, and this particular mentigrophytes, which particular test I have just told you? In the mentigrophytes, which particular test is said to be positive? Can you tell me up? Yes, please. There is hair perforation test. Remember this name. And what is this hair perforation test? Guys, the hair perforation test is this. Suppose this is the lesion na? From here you pluck the hair. Okay, and you put that into moist condition, because fungus grows in moist condition. And when you see that particular hair under the microscope after 2 to 3 days, what you will observe? You will observe these types of wedges. Okay, and that is termed as hair perforation test. Okay, that is termed as hair perforation test. Also, wedge perforation is the other name. Wedge perforation is the other name. And as Anurag, you have told the KOH mount. KOH mount is basically to see the hyphae, fungal hyphae, which can be observed. Another potent question is this also, that whenever we hear about this name of KOH mount, what should come in our mind immediately? So remember, what should come in our mind immediately is fungus. Okay, for the fungal etiology, we go for this KOH mount. That also needs to be remembered. And this hair perforation test is an important question. Why? Because this particular one differentiates between mentigrophytes and this particular one which I have just told you, that is a Trichophyton rubrum. Because if you see this particular list, okay, if you see this particular list of dermatophytic infections, everywhere 2 names will be there. One is mentigrophytes, one is rubrum. So how to differentiate between them? Differentiate between them on the basis of what? This particular wedge perforation or hair perforation test. This is positive in whom? Mentigrophytes. It is negative in whom? Negative in rubrum. Remember that. And extra point is urease positivity. Okay, you know the urease reaction, the color change from yellow to pink. So mentigrophytes is the one which is urease positive, and the rubrum is said to be what? Urease negative. Okay, rubrum is said to be what? Urease negative. Yeah, perfect, Lakshman. Now you remember Cariminati perforating his hairs and thinking he is doing some Virta wala work, that is verrucosum, and these mental activity fellow should be kept where? In the zoo, and you should put a ticket to watch that particular one. Okay, so now I think the questions regarding the Kirion you will able to answer up fully. Okay, and the extra point which I have told up is this hair perforation, wedge perforation along with the urease stuff. Urease is positive here, urease is negative in the rubrum, and the important aspect which I have just told you regarding rubrum is what? That it is having a red color pigment. Okay, it is having which kind of pigment? A red color pigment. Is it fine? So remember this particular thing also. Now coming to this, a child is presented with a history of pharyngitis. A child ho या adult ho, क्या है? Pharyngitis. Swab was taken, and this particular swab is being cultured. Okay, put on the culture plate. The swab material should be discarded where? Yes, please. Can you tell me where you should discard up this particular swab material, by which you have taken up the sample from a pharyngitis patient? Yes, where you should keep it? Is it the yellow bag you should keep, red bag, white box, or none of the above? Puneet have told A, Anurag have told yellow. Okay, that is A. Anybody else? Anybody else? Lakshman, yellow. Okay, right. Answer is no doubt yellow. Okay. So most of the waste of this particular stuff is going in what? Yellow. And if somebody asks you microbiology waste goes where? In the yellow. What about the red one? In the red. Those plastic rubber tubings, they go in red. Okay. White box is puncture proof container. Okay. So in this particular one, all those needle sharp waste is being kept in the white puncture proof container. And what about the like glass and all? Glass goes in? Yeah, Pooja, very right, yellow. Blue. Okay, glass goes in blue. Tell me which of these bags is incinerated? Incineration is being done of which particular ones? Again what? Yellow. Okay, again what? Yellow. Yellow is being incinerated at a high temperature of 800 to 1300 degree. The incinerators, and red bag should never be incinerated. That is also there. What about the urine bags? Urine bags are kept where? Yes, please. Urine bags. Yes, this tricky question can be asked. The urine bags are being put in what? Tell. Lakshman told yellow. Puneet told yellow. Is it right? Urine bags in yellow? No. Puneet, answer now, you are right. Urine bags are there in the red. Okay. Urine bags, urine is red. Urine bags are being kept in red. And the yellow, blood bags. Okay. The blood bags are being discarded into the yellow one. Yeah, Anurag. Perfect. Right. So these all important points you need to know. All the microbiology waste should be in yellow. Yellow is one which is incinerated. In the red, plastic rubber tubings, they are being discarded off. In the white, the puncture proof container, and the other one, the glass and all metallic implants, they are being put into blue. Fine. Now coming to the next one. Tell me about this one. Analysis of patient's stool reveals small structures resembling rice grains. Okay. Microscopic examination shows eggs, they have a barrel shape with plugs. Which of the following is most likely organism in this patient's stool? So can you tell me this particular one. The egg is having a barrel shape with plugs. Yes, please tell me. Waiting for the answer. Please tell. What should be the answer? Barrel shape with plugs. And Anurag, you are again right. We are talking about Trichuris trichiura. Okay. Trichuris trichiura, what is the other name? The other name is whipworm. And the egg of this Trichuris trichiura is the one which looks like this. That is the barrel shape with mucus plugs. Okay. And is it bile stained or non-bile stained? It is bile stained. Okay. This particular one is what? Bile stained. And how does the infection of this happens off? The infection of this particular one happens off by eating. Okay. Because this particular one comes in the mnemonic of eat. Eating the eggs. And what else comes in the mnemonic of eat? That is Enterobius vermicularis, Ascaris and Trichuris trichiura. All these infections, they happen by eating what? Eggs. And this particular one is a bile stained one which looks like a barrel shaped or dumbbell shape with mucus plugs. Okay. So answer to this particular question is what? Trichuris trichiura. This particular Ascaris lumbricoids, like in the later part, I will be showing you the picture also of this particular one, the various ones. Ascaris lumbricoids eggs, they are bile stained again, and they exist up in two forms. One is unfertilized egg and one is fertilized egg. Okay. The unfertilized is elongated and the proper shape is of the fertilized one. Enterobius vermicularis. Enterobius vermicularis, also termed as pinworm, it is having a plano-convex egg with a tadpole-like larvae. Okay, and Necator americanus exactly goes like its brother, that is the Ankylostoma duodenale hookworm, which is having the blastomeres. So in the Necator also, the blastomeres are there in the egg. Fine. So remember this particular one. Now tell me this. Identify the structure which is being marked up in the figure B. Okay. Obviously it is not being marked proper, but the thing which I like to tell up in this particular one, that they want to ask up that what is this particular area they are talking about. Okay. They want to ask up this particular thing. Identify the picture in the figure B, the one which I have marked up like this. It's already written there, so you can tell. So basically it's about the structure of the cell wall. Okay, and you know that a thick layer of peptidoglycan is a feature of gram positive, a thin layer of peptidoglycan is a feature of gram negative, then this periplasmic space is a feature of gram negative. Okay, this O antigen, this core and these LPS is a feature of gram negative. So obviously this particular portion, if I want to ask up, it is regarding the LPS. And what is LPS? LPS is lipopolysaccharide, and this particular lipopolysaccharide is exclusive in what? It is exclusive in gram negative cell wall, and this particular gram negative cell wall, you know, associates with the formation of a particular thing termed as endotoxin. Okay, this particular one associates with what? Endotoxin. And because of this endotoxin, what happens? Endotoxic shock. Okay, what happens? Endotoxic shock. So basically, you need to remember 2-3 things, that the O antigen means the somatic antigen derives from. So it derives from this particular LPS portion. Okay, somatic antigen is a part of this and it is derived from this particular one. Okay, against that the antibodies are being produced. Another one is a flagellar one, the flagella, which is there in the gram positive also, in gram negative also. So that is there. So basically these types of structures you need to focus upon, and they are being identified on certain points like thick layer of peptidoglycan, teichoic acid. Okay, remember this teichoic acid, I have already told her, पॉजिटिव लोग जिंदगी में ज़्यादा टिकते हैं, तो लाइपोटिकोइक एसिड इज फाउंड इन ग्राम पॉजिटिव. As far as the outer membrane and all things are concerned of, the outer membrane, this particular outer membrane, those who are negative in life, वो जिंदगी से क्या हो जाते हैं, out. So remember like that also. So these all things, they do help up in the exam, okay. And the other one important which can be there is O antigen derived from the LPS, and this particular one is somatic antigen. Fine. Now tell me about the 12th one. A truck driver presented with painless genital ulcer on the penis with enlarged lymph nodes. The motility of the organism responsible for this condition is best demonstrated by truck driver, they have given up, genital ulcer they have given up. Obviously they are talking about what? Some sexually transmitted disease, yes or no? And then they have talked about the motility of the organism, and obviously that can be seen under which particular microscopy? Dark field microscopy, in which what we use reflected light, okay. So it is being reflected in such a fashion that the background is dark, against which these organisms they shine off. So that is termed as reflected light is being used in which particular microscopy? In the dark field microscopy. Done for which fellows? Done for the spirochetes. And what comes in the spirochetes? What we are talking about here? We are talking about the painless genital chancre, which is a finding in the primary syphilis. What should be the incubation period of syphilis? The last INI-CET question, 9 to 90 days. It is the incubation period, that is 9 to 90 days. So basically in that you will not see any motility, na guy. Prabhat, you have told HSV, okay fine, I got that. But motility will not be observed na, in the HSV for sure. So if the motility word is there, you should think for a bacteria, and which one? That is obviously Treponema pallidum, and this Treponema pallidum does what? Syphilis. And which particular motility is observed of this? That is the corkscrew motility, which is not a true motility. Remember this, which is not a true motility. This also should be remembered, okay. So remember all these particular facts. In the primary syphilis, what you observe? Painless genital chancre along with the painless inguinal lymphadenopathy. Then these all things they heal up and the patient thinks I am okay, but this happiness of that fellow lasts for hardly 15 to 20 days. The fellow comes with a rash on what? Palms and soles. Along with that, condylomata lata, okay, that is the most infectious lesion. Then this also heals up. What happens? The patient goes into latency, and after 5 to 10 years even, that can comes with the tertiary syphilis, that is the complication associated with what? That is neurosyphilis and cardiovascular syphilis, along with the skin lesions like gummas, okay, they are observed in the tertiary one. And what happens in neurosyphilis? You know, neurosyphilis you have GPI, general paresis of insane, along with that tapes dorsalis, and in the cardiovascular what you have? Ascending aortic aneurysm, or that is being observed in the cardiovascular syphilis, okay. And drug of choice for the syphilis, that is penicillin. And which is the investigation of choice for the neurosyphilis? This might be your question in the exam. Answer is VDRL CSF. Answer is what? VDRL CSF. Along with that, if somebody asks you the most sensitive overall for syphilis is FTA ABS, and most specific for the syphilis is TPI. That is Treponema pallidum immobilization assay, which is not done obviously nowadays. Is it fine, guys? This is the way to go regarding the Treponema pallidum, a favorite of examiner. Again they ask up. And which microscopy? That is the dark field microscopy. And as per me, they can ask up this time also regarding the stains. And which stains is being used? Lividity and Fontana staining. Okay, lividity and Fontana staining you might find in the exam written up. Lividity and Fontana staining. And what these are? These are silver impregnation methods. What these are? These are silver impregnation methods. And why you need to impregnate the silver in them? Because they are very thin. So you need to impregnate them with that to visualize them properly. Is it fine? So this is the way to handle up these particular stuffs. Okay. Light microscopy, in that the transmitted light is being used. Electron microscopy, the electrons are being flown in electromagnetic field and they touch a screen, and then you can be able to visualize. Fluorescent microscopy, the fluorescent dyes are being used to change the short wavelength to long wavelength in the visible spectrum. So these are the ones which you need to focus upon in the microscopy also. Regarding the fluorescent dyes, I should tell 3 names to you. Out of them, one might get in the exam. One is auramine, rhodamin. They are being used for TB. Second one is acridin orange. That is being used for plasmodium. Okay, but this stains green. Remember that. Calcofluor white. That is being used for fungus. So these 3 names at least you should know. And Pooja, you were telling VDRL. VDRL is a test which is a non-specific test, non-triple test. Okay, it is being used for the prognosis of syphilis, but CSF VDRL is the investigation of choice for neurosyphilis. This is an important point. As such, Venereal Disease Research Lab is a slide flocculation test which needs microscope for its visualization. Okay. So these are the important points regarding all of these particular ones. One question is definite for them. Drug of choice, penicillin. Okay, and what about the congenital syphilis? In that you look out for IgM FTA ABS. Which particular immunoglobulin? IgA-M FTA ABS, not the IgG FTA ABS will be the investigation choice, because if anybody is having infection, obviously in the acute one, they will produce what? IgM, not IgG. Okay. So I think I have covered up all the important points of the syphilis, and one or two more. If somebody talks about the moth-eaten alopecia, that is being observed in the syphilis itself, moth-eaten alopecia, and there is a term termed as chancre redux. And what is the chancre redux? That is termed as early relasping syphilis. Chancre redux is what? Early relasping syphilis. The other guys in the spirochetes are also important. They are termed as Borrelia and the Leptospira. And the Borrelia, one statement is epidemic louse-borne relasping fever. That is being done by Borrelia recurrentis. And there is one which is termed as Borrelia Burgdorferi. That particular one leads to what? Lyme's disease. Borrelia vincenti, Vincent angina. Leptospira, triple R, rat, rice and rain. Okay, which particular serological test is done? So that is MAT, microscopic agglutination test. The last exam question was, in severe leptospirosis, what you will use? You will use penicillin, not the doxycycline. Is it fine? So these are the important points which you need to cover up before going in the exam. Okay. Now you tell this one. 13th question. A patient met with the RTA, okay, brought to the emergency room. The patient expectorated the blood on the floor. What is the first step to be taken in cleaning this particular one? Yes, please. What should be your answer in this blood spill question? What should be your answer? Tell me. Adil says A, okay. Add 0.5 to 1% sodium hypochlorite to this particular spill which have happened up. Anil also told A. Yeah, okay. Anybody else wants to try for this? Yes, please. Puneet told B. Okay. Yes, please. Anybody else wants to try? Sayan B. Okay. Sayan. Fine. What else? Answer to this question, guys, is B. Okay. You might be saying A. That is also like everybody thinks for that only. But important is, in any of the blood spill management, first thing is contain the spill. So you should put whatever available absorbed material is there onto that spillage, and then you will put this sodium hypochlorite. So first answer is B, and then you have to disinfect it. Okay. So this is a basic protocol in which the things are being done, that firstly you have to contain the spill. So the important is containing the spill. So contain the spill and then you put up 1% sodium hypochlorite to disinfect it, and you have kept it for several time, and then you in fact, if it is a good hospital, you have to ask of the infection control team to come. They will put up this sodium hypochlorite, and obviously with the proper gloved hands. After soaking that particular thing for certain minutes, they will remove it and they will clean and mop the floor as per the protocol. Okay, so important like lesson from it is what? You should contain the spill, not directly putting up the sodium hypochlorite. Yeah, Lakshman, don't worry, I will guide you. Now, please tell about this. A patient is suffering from severe gastritis, has undergone upper GI endoscopy. What is the best disinfectant used to sterilize this particular endoscope? So this is an easy one. I think most of you will answer this. What should be the answer of this particular one? Glutaldehyde, formaldehyde, butaldehyde, or orthophthaldehyde? Yes, what should be the answer of yours, guys? Please tell about this. Tell. Puneet have told A. Okay. Anybody else? Sayan have told A. Good. What else? What else? High Hopes told A. Satish told A. And answer is no doubt what? A only. Okay. The glutaldehyde. How much percent glutaldehyde? 2% glutaldehyde, which comes in the market by the name of Cidex or Cidex, is the best disinfectant used for these costly instruments like endoscopes, bronchoscopes, colonoscopes, okay, all sorts of scopes except your stethoscope. And for the stethoscope, what you will use? You will use spirit or isopropyl alcohol to disinfect. So remember this particular point also, that for all your scopes, what is being used? 2% glutaldehyde, Cidex, because they are very costly instruments, except your stethoscope. For that, you have to clean it with spirit or the isopropyl alcohol. Okay, isopropyl alcohol. This particular formaldehyde, can you tell me formaldehyde is being used in which forms and where? Formaldehyde is being used in the form of formalin. Okay, if you have gone in the very first year into the anatomy dissection hall, something irritates your eyes. It is this particular formalin. Okay, when you go into the second year, into the patho specimens you are seeing up. Okay, for that again your eyes get irritated. So anatomical and patho specimens, they are being preserved where? Into the formalin. Okay. Another one is this formaldehyde exists in the form of gas, and this particular formaldehyde gas is used in fumigation. Okay, it's being used in what? Fumigation. So remember this particular important aspect also. Yeah. Perfect. Now coming to the 15th one. Another good question. The contamination of a disinfectant is best assessed by which of the following test? Okay, is it the Riddle-Walker coefficient test? Is it the Chick-Martin? Is it Kelsey-Sykes? Or is it Morer's in use test? Yes, please. If you know, it's fine. If you don't know, just guess. Try to guess upon. Riddle-Walker, Chick-Martin, Kelsey-Sykes, Morer's in use. Which particular should be the answer here in this particular question? Please tell. Tell fast. A. Riddle-Walker. Renu have told Riddle-Walker. Okay. What else? Anybody wants to try more? Dr. Joy also told Riddle. Sayan is confused, telling up Chick-Martin. Okay. What else? Try this. Anybody for Kelsey-Sykes? Anybody for Morer's? Yes, please. Dr. Anil also told A. Dr. S also told A. Okay. Satish also told, Satish told C. Okay. Kelsey-Sykes. Good, Satish. Anybody else wants to try, or I should give the answer? The contamination of a disinfectant is best assessed by. Yes, please tell me. So basically, contamination disinfectant is regarding the efficacy of the disinfectant only. So you have to take this first as कि by which particular test you can assess the efficacy of the disinfectant best. So let me like simplify this for you. So can you tell me by which particular one you can tell up best efficacy of disinfectant? And the answer to this particular question is Chick-Martin. Okay. So answer to this particular question is what? Chick-Martin. Why? Because in the Chick-Martin, like one by one we'll go. In the Riedel-Walker, what is there? This is just a comparison with the phenol. Okay, this is a comparison with the phenol of what? Of the disinfectant which you have brought. Okay, of the disinfectant which you have brought. So that is just a comparison. Means certain Salmonella broth, certain Salmonella typhi broth is being killed by the disinfectant in how much time, and it is being killed by the phenol in how much time. In that you prepare up that particular, what do you say, a coefficient of it, and time you like record up. So that's why the name have come, Riedel-Walker coefficient test. Okay, Riedel-Walker coefficient test is a full name, also termed as phenol coefficient test. The basic comparison is there between phenol and disinfectant. Chick-Martin is what? All those things are there, but it simulates the original conditions. Means organic waste is being added to that Salmonella typhi broth. Okay, so Salmonella typhi broth is being taken as a standard one. This bacterial broth is taken as standard one. In that you add up organic waste. Organic waste is what? Organic waste is feces. Okay, or yeast, fungus you add up to this, that is the organic waste. So when you add up this particular organic waste, feces and yeast, and now you want to check up whether your disinfectant is still working or not. This is the real test of your disinfectant. Okay, disinfectant real test is this particular one, in which you have simulated the natural conditions. Which natural conditions? This particular organic waste along with this Salmonella typhi broth. The answer to this particular stuff is what? Answer to this particular stuff is Chick-Martin. Okay, what should be the answer? Chick-Martin. What about the calcicides and all? In the calcicides, what you do, guys, in this serial dilutions are done. Okay, you dilute the disinfectant. Serial dilutions of the disinfectant is being done in this, and this serial dilution means what? That suppose you have brought up a new disinfectant. Okay, you have taken 5 ml of it, and you have taken another 5 ml of broth. Okay, 5 ml of broth for that 5 ml. Then what you do? You dilute this 5 ml with double. You add water to this. Now it is, the amount is 10 ml, and you want to kill this 5 ml with this 10 ml. Okay. Again and again, what you will keep on doing up? You will increase the dilution of the disinfectant. Means if you are putting 5 ml into a bucket and still able to kill up that 5 ml of Salmonella typhi broth or any sort of broth which you want to test upon, then your disinfectant is very good. So basically what you calculate from the calcicides, the highest dilution of disinfectant at which this particular organism will be killed. So that is being done by what? Calcicides. So remember this particular one, that is being done by what? Calcicides. And the Morris in use or hospital in use test is what? That is the, actually when you use this particular disinfectant which you have brought for your hospital into the hospital for the commercial purpose, that is termed as in use or Morris test. Okay. So this is what you need to know regarding the disinfectant test. Firstly, again I am revising up for you. What is the first one? Phenol coefficient, in which you just do the comparison with the phenol, that in how much time the phenol have killed the this particular bacterial broth, and in how much time the your new disinfectant which you have brought up will kill up. So this is first. Second one, the real simulation of the conditions happens in the second one, that is the Chick-Martin, in which you add up the feces from your side or you add up the yeast, and that is the organic waste. Most of the disinfectant will lose their activity in this, but you want to test upon whether my disinfectant is still working or not, and if it is working, that's a very good disinfectant. So second one, Chick-Martin, is best assessing the disinfectant contamination. Second point, ठीक है. Third one is calcicize. Calcicize is serial dilutions. When you do the serial dilution of the disinfectant, means if you are putting up only 5 ml in 25 liters of water and still it is killing up a particular concentration of bacterial broth, it's a very good disinfectant. And when you actually use it into the hospital, that is termed as in-use test. Okay. So I suppose now this is being clear to you regarding the disinfectant stuff. Now talking about this, the Spalding classification of the medical devices: critical, semi-critical, non-critical. Okay. Critical means which enters at the sterile sites. Semi-critical means mucous membranes they are touching off. Non-critical means which just touch your skin and all. Fine. They are not going into touching any mucous membranes and all. So that particular thing is critical, semi-critical and non-critical. Semi-critical devices, they are best sterilized by which level of disinfectant? So can you tell me the answer of this particular one? 16th. Yes, please. Anybody wants to try for this 16th one? What should be the answer? Is it a high level disinfectant? Is it an intermediate level disinfectant? Is it a low level disinfectant? Or is it a sterilant? So Dr. Joy have told A, Anil have told A, Sayan have told A, and answer is A only. You all are perfectly right. The answer is A only, high level disinfection. Okay. Remember, for the non-critical one, you can use intermediate level disinfection or low level disinfection. For the critical and semi-critical, it is only one, and that only one is what? That only one is HLD. That only one is what? HLD, that is high level disinfection. Renu is also correct. The answer is A. High level disinfection for the critical as well as semi-critical stuff. For the non-critical only you have intermediate level disinfection and low level disinfection. Is it fine? And this is termed as which classification? Spalding's classification. Now tell about this question, which is like the previous INI-CET question also. The SARS-CoV-2 is classified under which biosafety level? Means in which biosafety level you should handle the SARS-CoV-2 virus, which does which particular disease? COVID-19. Okay, which does which particular disease? COVID-19. So can you tell me which biosafety level is used for handling up the SARS-CoV-2? Yes, please tell me. Waiting. Bhavya have told B. Okay. Anybody else wants to try for this? Please tell. BSL2. Okay. Anybody else wants to try for this question? The SARS-CoV-2 is classified under which biosafety level? Tell. Tanay have told B. Renu is telling C. Okay. Fine. What else? Dr. Joy told B. Answer to this question, guys, is BSL2. Biosafety level 2 is the one which is needed for the SARS-CoV-2. It's not a very dangerous virus, okay, to handle up. So you can easily handle in BSL2 levels. Okay. And what else you can handle in BSL2? In BSL2 you can handle herpes simplex virus, guys. Okay. Herpes simplex virus you can handle up. Even it is being said that this particular bacteria, Salmonella, is to be handled in what? BSL2. Okay. It should be handled in what? BSL2. Important is in the case of BSL3. Okay. In the case of BSL3, what needs to be like kept upon? This question had come before, again it will come. Remember TB. TB bacteria, that is MTB, is to be handled in which biosafety levels? That is the BSL3. MTB and MTB, or you are like handling up MDR TB or XDR TB, you need to have which particular biosafety levels? 3. So BSL3 is to be for the TB, one name you remember. Other than that, if somebody asks regarding that Yersinia pestis and all, that is causing up the plague and stuff. So this you can remember of. Regarding the BSL4, already the question had come. So that is for the filamentous viruses like Marburg and Ebola. Okay, Marburg and Ebola. क्या बोला? Ebola. So Marburg and Ebola, they are biosafety level 4 entities which you need to know. Biosafety level 4 entities that you need to remember. Marburg and Ebola. And other than that, if you want to put up other names also here, that is the smallpox virus. The smallpox virus, that is variola. That is also there. Exactly, Sayan, you are fine. Culture is being done in BSL 3. Okay, the culture is being done in BSL 3, but the handling of the SARS-CoV-2, like if you say that you are doing RT-PCR and all that, that is being done under which particular biosafety levels? That is the 2. Is it fine? So basically, yeah, this particular point which Sayan have told, that is also to be remembered, that if somebody asks you the culture, if you are doing up, the culture of SARS-CoV-2, okay, that is to be done in the BSL 3, okay, this is also there. So, this is always a confusion, whether you should keep it in BSL 2 or BSL 3, but it is, if you are not doing the culture and all, then it is normal to handle it in which particular category? BSL 2, okay. So, if the question is like this, that you are doing up the RT-PCR, okay, that is the reverse transcriptase PCR. So, in which particular biosafety level you should do that? The answer is, for this, the biosafety level 2 is there, okay. And for the culture, if you are doing the culture of it, and the culture is being done for what? For the vaccine production, this particular one, okay, for the vaccine production, it is to be done in BSL 3. Fine. Now, coming to this, the smallpox is being classified under which bioterrorism agent category? Is it category A, category B, category C, or category D? Yes, what should be the answer in this particular one, if you can tell? Yes, please. Smallpox is in which category? Dr. Joy have told category A. Okay. What else? Anybody else wants to try? Puneet is telling A. Okay. The answer is A only, guys. Category A, bioterrorist weapon is smallpox virus. Okay. Along with that, the one which does plague is to be categorized as the category A bioterrorist stuff. Okay, the various viral hemorrhagic fevers causing agents like which one? Just now we have done Ebola, Marburg, even KFD, yellow fever. They all are being considered as viral hemorrhagic fever. They are also in the category A. Okay. Then smallpox. The bacteria doing up botulism, okay, anthrax, and even this particular one, that is tularemia. These all, they come in category A, okay. What all names are there? The plague, Yersinia pestis 1, viral hemorrhagic fevers, Ebola, Marburg, KFD and yellow fever, smallpox, botulism, anthrax, tularemia. These the names which you should know. They are being kept in what? Category A. And regarding the category B, only one question is being asked, and that particular question is what? That brucella comes in which particular category? So remember, brucella comes in category B, and whole lot of list is there. No need to remember that particular one. Okay. Then category C is there, the new emerging ones. The new emerging ones is which one? Nipah, okay, SARS-CoV-2 you can keep here in the category C, okay, and all others which you think they are coming up and they can pose up a challenge to us. The new emerging threats, they are being kept in which category? Category C, okay. So new emerging ones in category C. Category B need to know this brucella only, and this particular one, that is a smallpox, is there in the category A, okay. So these all names you need to know regarding the various bioterrorist categories. And category A is the most important. All the names you should remember: plague, viral hemorrhagic fever, smallpox, botulism, anthrax and tularemia. And one confusion happens, guys, and this might happen again, that this B, botulism, and the category B also is B, that is brucella. Brucella is category B, okay. And how to remember? Brucella is having two L's, so it is in category B. Absurd association, obviously. Botulism, this is category A, okay. This is category A, so this needs to be focused upon, that which particular category they are asking up and where I have to put up, okay. Now, this question everybody knows, I suppose. The shingles is being caused by what? The shingles is being caused by what? The shingles is being caused by which particular herpes virus? Yes, please. It's a simple one. You should tell this. The shingles is being caused by what? Yeah, tell. Shingles is being caused by what? Simple one it is. Please tell. You all are there or not? Puneet told C, and Puneet is perfectly right. Anybody wants to try? HHV3, Bhavya have told, KK have told C. Okay. Dr. Joy have told C, 3. Okay. Fine. And as usual, you are all perfectly right. This is human herpes virus 3, shingles. Okay, the virus name is human herpes virus 3. It is also termed as chickenpox virus. Okay, also termed as varicella zoster. Okay, and the shingles is actually what? The reactivation of chickenpox. Okay, reactivation of chickenpox is termed as shingles, also known as herpes zoster, and mostly it happens in old age, okay, or if it is happening in the young age, it is due to some emotional stress like lung breakdown affair, okay, because of some exam and all, this particular herpes zoster happens off, okay. So like remember like this, that after an emotional distress of breakdown or the affair, somebody have become what? Single. So shingles is reactivation. Reactivation of what? Reactivation of chickenpox. Okay, done by which virus? Varicella zoster. So remember, chickenpox virus is not a pox virus. It's a herpes virus. Which number? Human herpes virus 3. Human herpes virus 3. Okay. Now certain important points. If somebody wants to know about shingles, okay, you know that there are two things. One is herpes zoster oticus here, and one is herpes zoster ophthalmicus here. In the herpes zoster oticus, you know, the name is there, that is termed as Ramsay-Hunt syndrome. Ramsay-Hunt syndrome, in which what is there? The Bell's palsy. Okay, Bell's palsy along with the vesicles over the external auditory canal, that is over the tympanic membrane, they are there, and geniculate ganglion is involved up. Whereas in the ophthalmicus, single-sided lesion of the face, and if the tip of the nose is involved up, that is being termed as the Hutchinson's rule. Means there is a 100% involvement of the eyes also. There might be a corneal ulcer, which later on might lead to what? Blindness. So that also he needs to remember. The herpes zoster oticus and herpes zoster ophthalmicus, these two names you need to know first of all. And in this, there is a single-sided lesion ophthalmic branch of trigeminal nerve that is being involved up in this, and T3 to L3 dermatomal involvement is observed in the herpes zoster ophthalmicus. Okay. Yeah, Bhavya. And this question also everybody knows that who had suffered from Ramsay-Hunt syndrome. Just now this Bell's palsy happened to which particular famous star? So this also everybody knows. You can answer up also. Okay. So this is what is termed as shingles. And what about the chicken pox? In the chicken pox, certain important points are that if somebody asks you that what should be the incubation period of this, and directly they are tell me one particular figure. So 19 days, okay, 19 days, otherwise 2 to 3 weeks, or some they write 14 to 16 days also. That is also there, but a single answer is 19. Then if somebody asks you what should be the infectivity period of it, rash 2 days before, 5 days after. And sometimes they write up until the scab falls of the child, you should not send the child to the school. And if both the options they come, then the better answer is 2 days before and until the scab falls. Dewdrop on rose petal. This particular typical appearance is a feature of chickenpox. Centripetal distribution of the rash, pleomorphic rash, is a feature of chickenpox. Which particular strain is being used? Oka strain. And if a pregnant lady gets infection, can develop congenital varicella syndrome, which is very rare nowadays, and everything becomes what? Small in that. And what is that small? Chorioretinitis, okay? Cicatrizing lesions, there is a limb hyperplasia, okay, scarring is there. So all these that you need to remember. And you are right, Bhavya, Justin Bieber is the one who developed this Ramsay-Hunt syndrome, okay. So these are the important points regarding the chickenpox, and the number they can ask of, the number is HHV3, human herpes virus 3. Now see this question. A patient presented with complaints of breathlessness at rest, cough and right-sided chest pain since 15 days. She had completed successful ATT 8 years ago and was again advised ATT for her current condition. On a chest radiograph, there are right-sided non-homogeneous opacities involving all the zones with air fluid levels, and the left lung mid-zone infiltrates. The sputum examination showed the findings as in the figure B. What is the causative agent for the same? Yes, please. What should be the answer of you? And focus upon this particular figure B. What is there? I am like zooming it for you. That in the figure B, what you are observing up. Good question. And if you want to see the question again, this is there. Somebody was on ATT, again advised ATT for the current condition. On a chest radiograph, there was a right-sided non-homogeneous opacities, and the figure B tells the story. So, can you identify the figure B? Yes. Type 1, which is rash, face and mouth. What is this, Lakshman? What do you want to ask? What should be the answer, guys, here in this particular one? As the high hopes have told, as the Cyan have told, as the Dr. Joy have told, and they are perfect in that telling, answer is nocardia. This is nocardia, a filamentous bacteria which is acid fast. How much percent acid fast? 1% acid fast is responsible for causing up these particular stuff in this particular patient who was previous TB patient. Okay. So answer to this particular question is what? Nocardia. So how to observe these all things? Because nocardia, you know, it's a strict arrow. It will involve the lungs and it will cause these types of problems. No doubt in that. And that fellow is a known case of TB. So definitely it can be a secondary infection here in these particular patients. Okay. Other than that, this picture itself is telling up filamentous, and they are entrapped into each other. So this is a filamentous bacteria. And can you tell me in the comment section that this particular nocardia, how you will culture this? How you will culture this particular one? By which method the nocardia is being cultured? If you can tell, by any means. This particular nocardia is being cultured by a method which is definitely can be asked in INI-CET exam, and that is paraffin bait technique. The name of that is what? The paraffin bait technique. Okay. And what is this paraffin bait technique? A carbon rod on which it eludes and comes and sits, and you can able to culture that particular one. So that is what is termed as paraffin baiting. And how to remember that? Remember like this: Nauka per bat. Okay, Nocardia, Nauka per bat. So that is paraffin baiting or paraffin bait technique. Yeah, right, Ahmed, right, KK. So that is the paraffin bait technique which is being used for nocardia. Okay. So nocardia, if somebody asks you, extrapulmonary involvement most common is what? Brain. And in the brain it can produce what? Abscess. So brain abscess is there in that particular scenario also. And the fellow to whom you compare this, that is the actinomycetes. And actinomycetes, the most common location is this. What is this location? Cervicofacial, the angle. Okay. Then what should be the triad here? When there is a sinus, there is a swelling, there are sulfur granules. And sulfur granules of which color? Yellow color. When you bring out those sulfur granules and crush them, see them under microscope, what do you observe? You observe a sun ray appearance. And what is there in the sun rays? Organism. Okay. So all these are important points which you should know. They are being asked again and again. And which organism is there in that Actinomyces israeli. Okay. One extra point just now I'd like to tell up. There is one which is termed as Actinomyces israeli, which does this particular ailment, oral actinomycosis, also does PID, pelvic inflammatory disease, and there is one fellow, Tropharema whipplei, which does the Whipple's disease. This particular Tropharema whipplei associates with culture negative endocarditis. This associates with what? Culture negative endocarditis. So remember this particular important stuff also. Okay. After a while, we'll take a break after 15 minutes, and after the break, this particular questions, they are around 75. So we'll be ending up on our app of the NExT. So you can download it from the link which is being given up, and that will be shared in the chat box also, that particular link. So you can download, and in that the further questions will be discussed of, and definitely I am thinking like this particular thing is helping you to tackle up the various stuffs which can come in the form of different things. Okay. So let's come to the next one. The next one is a sex worker developed red beefy painless ulcer in the genital area which bleeds on touch, and pseudobuboes were present in that. What is the diagnosis? So a simple one, it's a direct one, and you can also tell up. So guys, after the break, we can discuss up I am discussing up all these particular ones on my NExT app. Okay, so you can download it, and there you can see up live all these particular ones, because after the break we will not be continuing on the YouTube. Okay, and obviously you can go into the Play Store and can easily download the NExT app, in which we will discussing it after the break. And most probably we'll taking the break in 10 minutes, and we'll be starting up again at 2 o'clock or 2:15 round. I will be telling up, that will be displayed. Okay. So tell me what should be the answer, guys, here in this particular one of yours. A sex worker developed red beefy painless ulcer in the genital area as shown in the image, which bleeds on touch, and the pseudobuboes were there. What is the diagnosis? Yes, please. Tell me up. Tell her. What should be the answer of this? Is it A, granuloma inguinale? Is it lymphogranuloma inguinale? Is it syphilis, or is it chancroid? The answer is granuloma inguinale. Okay, answer is granuloma inguinale, and this is being done by which particular organism? Calymitobacter granulomatis. It is being done by what? Calymitobacter granulomatis or Klebsiella granulomatis. Klebsiella granulomatis. Okay. So guys, can you tell me one particular thing, that this Calymitobacter granulomatis or Klebsiella granulomatis, is it bipolar stained? Is it bipolar stained, this particular one? Yes, please. So this particular one is bipolar stained. Okay, having which type of appearance? Safety pin appearance. So this particular important entity also you can find out in the exam regarding the Klebsiella granulomatis. This is bipolar state. And what about these pseudobuboes? They are not inguinal lymph nodes. They are the granulomas, and that's why the name have also come granuloma inguinale. The name have also come the granuloma inguinale. Is it fine, guys? So remember this particular point, that we are talking about this granuloma inguinale, and it is having a characteristic beefy red ulcer which is painless, and this one bleeds on touch, and pseudobuboes are observed in this. And can you tell me which bodies are seen in this? This is also termed as which other disease? This is also termed as donovenosis. Okay, this is also termed as what? Donovenosis, and the bodies which are observed in donovenosis are Donovan bodies. And what are these? The macrophages. They try to engulf this, and within them also they survive, and they give the appearance of these Donovan bodies. So basically, this organism is observed inside the macrophages, and that is what is termed as Donovan bodies. Okay. So this particular one you need to know. Now coming to the next one. That is this. Identify the virus in this particular figure D. Which virus is there in the figure D? Tell me. Which virus is there in the figure D? So this is probably the last question before the break, and after that this particular test and discussion will be on the NExT app. Okay, so you can download it and you can see it there, the rest of the questions. Yes, please tell me. Identify the virus in the figure D. Which virus we are talking about in the figure D? D is this, guys. This one is the D. Tell me which one it is. B. You are telling B, adenovirus. Okay. Anybody else wants to try for this question? Adeno. Renu also told adeno. Okay. Guys, I am asking out this D. Remember. Not the first one I am asking. I am asking about this D in the question. Identify the virus in the figure D. Yes, please. Tell me fast. Anybody else wants to try? I just want to tell up adeno is wrong for the D. Now you can try second one. D. D is corona. Okay. Praveen have told D. Okay. Anybody else wants to give a try? Rota. Sahil told Rota. Puneet told corona. So guys, this is coronavirus. This D is coronavirus. The answer is D. Coronavirus it is. Crown-like projections. Bilkul. The first one. This is adeno. Okay. This is adeno. Space vehicle-like. This is adeno. This particular one is smallpox. This particular one is what? The smallpox virus. This one is Ebola. Kya bola? Ebola. This particular one is crown-like, that is corona. This everybody should know. Without that, you should not go into the exam itself. That is rabies virus. That is a bullet-shaped virus. And what is the speed of this bullet? Rabies virus speed 3 mm per hour. What should be the speed of it? 3 mm per hour. C is Ebola. Yes. What about this F? This is Rota. Okay. This particular one is rotavirus. This particular one is rotavirus. So first one is adeno, guys, space vehicle. Second one is smallpox. Third one is Ebola. Fourth one is corona. Fifth one is rabies. And the sixth one is rota. Sixth one is what? Rotavirus. Okay, all of them, they can be asked in the form of images, and they can give you a case explanation, and they can ask up, and along with that they can ask up single standard, double standard, all those of things which we'll discuss up afterwards, that which are non-enveloped, which are single standard, which are double standard, which is segmented, which is having negative sense, all those particular things we'll be discussing up later on. Okay, so now we are taking up the break. Okay, and we'll start up at around 2 or 2:15 round. In between that the time will be put, and you can download up the NExT app, and the link will be shared here also. You can go from that particular one and then can download up the app.